A healthy mouth for the whole family. Classes on oral health and oral care for yourself and your child. During pregnancy, it is good to become aware of the link between oral health and general health. Come to understand the importance of oral self-care and to be aware of being a model for the child in the family's everyday life in creating healthy oral habits. Oral health care affects the health of the whole body. The mouth acts as the whole body's infection gateway. The spread of bacteria through the bloodstream to the rest of the body and through the placenta to the fetus. Poor oral hygiene exacerbates many diseases, including cardiovascular diseases and diabetes. Inflammatory disease of the mouth can prevent or slow down the healing of various diseases. Your oral health affects the way you eat, speak, and look. Signs of a healthy mouth are pleasant breath. There is no pain in a healthy mouth. There are no bacterial diseases in a healthy mouth. No gingivitis, tartar, or tooth decay. The mucous membranes of a healthy mouth are clean and have no sores. With a healthy mouth, it is easy to smile. You can influence how your mouth feels. Pregnancy and oral health care. Risk factors for oral health during pregnancy. Hormonal changes affect the mouth. At the end of pregnancy and during breastfeeding, the number of bacteria harmful to oral health increases. The risk of decay increases because the pH of saliva decreases, and its restorative effects may be impaired. The number of acid attacks increase if or when you eat more frequently. This increases the risk of tooth decay. Pregnancy itself does not cause gingivitis, but it can make an existing infection worse and more prone to bleeding gums. The nausea and vomiting associated with pregnancy can increase tooth erosion. You should not brush your teeth after vomiting. To neutralize the acidity in your mouth, rinse your mouth with water and eat things like cheese or nuts. Some oral microbes can be carried in the bloodstream to the placenta, increasing the risk of pregnancy complications and preterm birth, and may be linked to low birth weight. Dental care during pregnancy. You should take care of your oral health every day and go to the dentist regularly. It is a good idea to get your mouth and teeth sorted out when you are planning your pregnancy. During pregnancy, the aim is to avoid major operations. During the first trimester, an oral examination and preventative dental treatment can be carried out. During the second trimester, any necessary corrective treatment can be carried out, for example, filling cavities. In the last third, any procedures are avoided. There is no need to avoid local anesthesia during pregnancy. X-rays of the teeth may be taken if necessary or appropriate for treatment. Make good oral care a daily routine. Oral self-care. Brushing your teeth twice a day, 2 minutes at a time, preferably with an electric toothbrush. Use fluoride toothpaste. Do not rinse your mouth. Leave the paste in your mouth after brushing. Regular cleaning of the interdental spaces by using dental floss, interdental brush, or toothpick. Xylitol after every meal. Cut off acid attack in 5 minutes. Slow down plaque growth and reduces the amount of plaque, making it easier to brush off. Used by mom and dad, it prevents the transmission of bacteria to children. Do you give your teeth a rest now and then? Everything else you eat or drink causes an acid attack, except water and xylitol. Acid attack. Acid produced by bacteria from sugar dissolves the tooth enamel. Teeth can withstand 5 to 6 acid attacks per day. Snacking maintains a constant acid attack. The consumption of sugars and sweet drinks should be done in connection with meals. Drink milk or buttermilk with meals. Drink water when you are thirsty. Acidic drinks often cause the enamel of the tooth to wear down. Tooth development and teething. A baby's milk teeth develop in the 4th to 5th week of pregnancy. Nutrition during pregnancy affects the development of the fetus teeth. There are 20 milk teeth and 28 permanent teeth. Milk teeth are in the mouth from around 6 months of age. Milk teeth start to change into permanent teeth around the age of 6, but milk molars start to change much later. When a tooth appears, the gum is tight, sore, and swollen. The child might show the following symptoms: weepiness, restlessness, loss of appetite, and increased saliva secretion. It can be difficult to brush the teeth. When a permanent tooth emerges, it pushes the milk tooth in front of it, dissolving its root, and the tooth falls out. When a tooth emerges, the enamel is still developing. Good oral hygiene is important. Children's dental care. Breastfeeding and pacifiers. Good mouth self-care from the beginning. The example of an adult and the habits of the family are important. Brushing should start twice a day as soon as the first milk tooth emerges. For 0 to 3-year-olds, use fluoride toothpaste, a small thin spread on the brush, twice a day. For 3 to 6-year-olds, use fluoride toothpaste twice a day, the size of a small pea. When the first permanent teeth emerge, switch to adult or adolescent toothpaste, twice daily. Avoid saliva contact, nothing from your mouth to your child's mouth. Avoid giving the children sugary foods and drinks. For a thirst-quenching drink, offer water. Take an interest in your child's dental care. An adult is responsible for looking after a child's teeth until the age of 12 years. Breastfeeding and a pacifier or bottle. Breast milk alone does not cause tooth decay. Breastfeeding can increase the risk of tooth decay if the diet includes sugary products, the child's teeth have not been taken care of, and there is plaque in the mouth. Breastfeeding helps your child's bite to develop correctly. A pacifier can comfort a child by satisfying their natural sucking reflex. A pacifier rather than a thumb. Choose the right pacifier, anatomical and flat. Check the condition of the pacifier regularly. The use of pacifiers and bottles can start to decrease at 6 to 8 months of age and should stop by 1.5 to 2 years of age.